Nurses look after people. We learn to look at people's lives in a different way, in a more complete way. Being there with them when they're born, being there with them when they're dying, supporting their families through that process, and having a means of changing a horrible moment into something that can be a peaceful moment. I think that's what really brought me into the profession.
A nurse is someone who looks after people in the worst and best times of their life. That could be a little thing like you could braid their hair or get their mum or dad a coffee, or it could be a big thing like you could pick up something that could save their life. You're there constantly, and I love that about nursing, that you're with the patient more than any other health professional. You'll be there with them through the whole day and see little things, and that could be the difference between their condition getting worse or getting better.
The Bachelor of Nursing is a 3-year program. During the first year, the focus will be anatomy and physiology, so learning about the human body. There will also be a focus on fundamentals of care, fundamentals of nursing practice. In the first year as well, they go out to placement.
My first one was 8 weeks into the degree, so I got to see straight away whether nursing was for me or not.
Students need to see patients early. They need to get used to patients, they need to get used to talking to families, they need to get used to talking to the multi-professional team. That's one of our main advantages. They will have activities that involve simulation around communicating with patients and patient assessment. We involve actors in these activities at simulation so that becomes more realistic. So they are communicating with real people.
My name's Alicia, I'm the registered nurse we'll be looking up. Thinking back on that, I feel like those things really helped because you literally felt like you were in a real setting and like this was a real patient. You'd forget that you were just learning, and then when you were in that situation in real life, you kind of already had that experience. It also really helped in like building communication skills because you're talking with an actor who's, they don't step out of their role at all. They're that patient, so you have to learn how to talk to them, but it's in a safe learning environment, so it's okay to make mistakes.
In the second year, there's a focus on pathophysiology and disease process. So that's when they understand what happens when the body is not functioning as it's designed to function. They will have introduction to pathophysiology. They will start to connect anatomy and physiology that they learned in the first year to pathophysiology in the second year. They will also have placements that are more specialized.
I had a paediatric placement. I went in the country for 4 weeks. I worked in an adult intensive care unit and on a surgical ward, like just the diversity of areas I was able to see, I really loved.
They will apply their knowledge of physical assessment and their skills in physical assessment to the disease process. And they will understand what's happening to patients in a more complete way. They will apply their pharmacology knowledge from the first year to the treatment of these disease processes as well, and to the pathophysiology. And they'll start to have a more complete idea of what's happening, what brings people to hospital, what happens when the body is not working as it should. In their third year, they will expand their scope, so they will learn more about communication. They will have placements that are focused on the acute care. They will learn more about pathophysiology and how to look after patients, from patient assessment to medical management and nursing management. They will be supported to apply their knowledge that they've gained in the first and second years in a lot more complex situations, and they will expand their scope then by the end of third year to the scope of a registered nurse.
My time as a student at Adelaide Uni was so great. Like all the lecturers, most of them are nurses themselves, and they're just so supportive of us throughout the years and really got to know us as well.
We have amazing professionals. We have amazing academics that really care. It's about putting knowledge, skills, and passion together. And we can only teach that if we have that. And I believe all professionals here at the Adelaide Nursing School have that.